It is obviously very important to help with infection control in the long-term care facilities. So it's important to know the chain of infection and knowing that if you break one link of it, that the infection will not spread. So hand washing is obviously the most important. Um, Standard precautions have to do with like body fluids like blood, spit, saliva, or not spit, but like urine, fecal matter, things like that. And then transmission based precautions have to do with like the droplet, the airborne, and all of those, the touching and everything. It's important to know which precaution you need for which patient. So like droplets, with some patients you want to do what's best, like having the inverted airway and the isolation based precautions and things like that. It's important to know what you're dealing with when you enter a patient's room and to try to prevent the spread, of course, as much as possible. And with that, you would use PPE or gloves or gowns and air masks for airborne or droplet precautions, things like that. It's really important for elderly patients because a lot of elderly patients have a low immune system, or they might have a disease that could cause them to get sick. And so we want to stop the chain of infection as soon as possible. Hand washing is very important. Obviously, you want to wash your hands, scrub, get all the germs off, make sure you don't recontaminate them. You want to make sure you put don and doff your gowns correctly. Gloves would be important for touching a patient. Goggles if something spews in your eye. Cleaning spills, obviously you want to be very careful when cleaning spills. There's might be bodily fluid, so you would want gloves. You'd want to keep it as contained as possible. You'd want to disinfect. Cleaning equipment, use an autoclave or disinfect or anything like that. And then laundry, if it's contaminated, you want to put it in the hazard. You would want to put it in a separate bag, in a red bag, I believe. And you'd want, so the laundry people know that there might be urine or blood or anything on it, so they know that if they touch it, they might potentially get infected.